Welcome back to Long COVID Doctor, an educational series for all of those of you who still have long COVID. I'm Dr. Tim Robinson, formerly a family doctor, a GP for 30 years, now working in Long COVID Services for 5 years. I post on all the usual podcast channels as well as on YouTube. I hope you find them helpful, and if you do, please click subscribe and share them with anyone else you know who has long COVID. Let's spread the word. Let's get the word out there. So thanks also for all the feedback you send in, comments and queries. I do apologize. I just haven't got the time to reply to all of you individually. I just wish I had the time, but I just don't. But that's not to say, please keep them coming, because I actually find them helpful for my future postings. Another apology, my usual disclaimer. It's important. Any advice or treatment I mention should only be considered after discussing with your own doctor. So, here we are. This is the talk all about swallow problems in long COVID. And in it, I will cover the symptoms, what our patients are telling us, what they're experiencing. And I'll talk about the causes that lead to and result in those swallowing problems. I will also explain any treatments that are available, as well as strategies to help with those swallowing problems. So here we go. Swallowing problems in long COVID. It has to be said that swallowing problems in long COVID aren't that common. However, basically, if you have them, you know about them, and they are a nuisance. But like I said, not as common as those other biggies like fatigue and brain fog and pain and headache and, palpitations or temperature problems. But if you've got swallowing problems, along with it, all those other long COVID symptoms, you know about it. And, it just adds to your symptom burden and takes from your quality of life. So therefore, they need to be addressed. They need to be taken seriously as well. Any new symptoms needs to be taken seriously and assessed by your own doctor. So first of all, what are our patients actually telling us? What are the swallowing problems that they're experiencing? Well, it can range from a whole range of symptoms that they are being troubled by. That would be clearing of the food from their mouth into the throat. They're finding that difficult. Maybe because they haven't got enough saliva. Their mouth is dry, or maybe because there's inflammation of the mouth or the throat, the pharynx. Patients complain of food getting stuck, maybe in the throat itself or further down in the esophagus, in the gullet. Patients often point to exactly where they feel that their food gets to, and that's their area of discomfort. They can say, this is where it gets to. It doesn't go any further than this. Patients also have the sensation that they feel that they have to swallow repeatedly to get a single mouthful down, and often they have to really concentrate to get that mouthful down. Normally, you and I, if you don't have swallowing problems, I don't have swallowing problems, but if you don't have swallowing problems, you swallow automatically. Food goes down without thinking about it. You don't have to consciously think, I've got to get my food down. Some patients are telling us, actually, I've really got to focus on, concentrate on getting my food down. This is quite a common symptom. Some people find that solids are difficult, that liquids aren't. So they then, because of that, find that they actually will chop their food up really fine, or even blend it, or even just revert to liquidy foods like soups or porridge or that sort of thing. Regurgitation is another swallowing problem. Food coming back up. Coughing and choking with food. Again, these are symptoms that patients are bringing us. They may also have heartburn and indigestion associated with their swallowing problems. So burning behind their sternum, behind their chest bone. And associated with this, they may have sort of a watery, saline taste of water coming up into their mouth, a condition called acid brash. And finally, they may complain of a lump in the throat. Doctor, I've got a lump right here in my throat. And that's a condition called globus pharyngeus. I'll explain that in a minute. So those are the sort of common symptoms that our patients are bringing to us. There may be associated symptoms such as excessive mucus, sort of catarrh going down, or excessive nasal catarrh. And with that, there may be excessive throat clearing. Patients may have also identified voice problems or difficulties or changes in their voice associated with their swallowing problems. There may be a dry, irritating cough. There may be weight loss, either because they have had to become quite selective about how they ate, when they ate, etc. And so that has caused them to lose weight. They may have, along with their sort of package of long COVID symptoms, they may have dysautonomic symptoms such as fainting feelings or palpitations, heart fluttering, or problems with temperature regulation. And they also may be understandably anxious. So if you feel that you're going to have a problem with getting food down, then that can cause people to understandably worry and get concerned, asking questions like, why is this? Or what's going to happen? Will the food become blocked and dislodge and not able to dislodge it, etc. So these are natural anxieties, worries that patients bring us. Those are the symptoms and the associated symptoms that patients are telling us. So the question is, what brings them about? What brings about those swallowing problems, symptoms? Basically, anywhere between the back of the throat and the stomach can become inflamed, like long COVID inflamed, if you like. So we know that in long COVID, one of the root cause problems of long COVID is excessive inflammation and persisting inflammation, following on from the acute viral SARS-CoV-2 infection. That persisting inflammation is brought about by, we remember the cytokine storm, so excessive cytokines. The storm may have settled, but there may be still excessive cytokines knocking about in the tissues. But also excessive inflammation may be there because of mast cell activation. Again, another common problem as a result of an excessive innate immune system response. So cytokine damage and mast cell activation both lead to inflammation of the gut lining. And like I said, that can be anywhere from the mouth down to the stomach, resulting in pharyngitis, inflammation of the pharynx, laryngitis, inflammation of the larynx, esophagitis, inflammation of the esophagus, the gullet, gastritis, inflammation of the gastrium, the stomach. Other causes? Again, it's a long COVID thing, isn't it? Dysautonomia, dysfunction of the autonomic nervous system. Something has happened in the autonomic nervous system at its origin, namely the brainstem, part of the long COVID process. And then that has resulted in dysfunction, malfunctioning of what the brainstem areas of the autonomic nervous system do. One of those is the cranial nerves, 9, 10, 12, whose function is the swallowing and throat movement and tongue movement. So if there's dysfunction and impairment of the 9, 10, and 12 cranial nerves, that's going to cause problems with the timing of swallowing. Likewise, another dysautonomic problem is breath-swallow discoordination. So normally, breathing and swallowing, they're all part of that same area. And, we're breathing with your vocal cords open enables you to speak, air coming out. But swallowing, your vocal cords are shut to stop food going down into the chest. So if the nerves that serve those muscle structures are not working correctly, then that coordination is lost, and then that can lead to swallowing problems. So I talked about dry mouth because of lack of saliva. That can be because of dysautonomia. So the salivary glands are not secreting when they should. And so therefore the food is not becoming moist. Therefore the food bolus is not binding together properly. Therefore it doesn't go down the throat properly. Swallowing problem. And finally, what we call dysmotility, or motility problems, movement problems of the food going down from the throat, down the esophagus into the stomach. That process is known as peristalsis. That's the movement of the smooth muscles that line the esophagus, the contraction and relaxation of the esophagus to push food down into the stomach. That's controlled by the autonomic nervous system. If you have dysautonomia, as in dysfunction of the autonomic nervous system, that leads to dysmotility or problems with peristalsis. Therefore, food does not go down the food pipe, the gullet, as it should do. So, those are the causes and the symptoms of swallowing problems. Very interesting, but more importantly, what are we going to do about it? How can we treat this? Okay, so, any new problem, of course, you've got to see a doctor. Why? Because we need a diagnosis and we need guidance as to how to manage this problem. There may be a treatment, there may be a referral that's needed to the hospital specialist, a gastroenterologist who knows all about swallowing problems. Maybe a referral to a speech and language therapist who can help us with the swallowing side. Speech and language, they don't just do speech, they do language, they don't just do speech, they do swallowing as well. So, gone off to your doctor with your swallowing problem, doctor, and the doctor will, doctor, I've got a swallowing problem. So the doctor will find out what you're actually experiencing. Namely, they'll quiz you a case history of the symptom, how often you've got these swallowing problems, when they occur, how long for, those things that make the swallowing problems worse, or what you do to actually bring relief from your swallowing problems. They'll also ask about any associated symptoms like any cough you might have, or sort of throat clearing, or pains elsewhere, or in the chest or in the stomach. They'll ask about weight loss. They'll ask about any speech problems, anything associated with the whole sort of swallowing area, if you like. Having gone through the history, then the doctor will want to perform an examination and do some investigation. So examination really, the doctor will maybe want to look in the back of the throat if your swallowing problems are quite high up. They may examine the neck for any lymph glands. They may examine the abdomen, make sure it's soft and non-tender. Investigations, I think it's a case of just doing the usual blood test panel for long COVID, standard blood test, looking for blood count, liver, kidneys, thyroid, and checking for diabetes, etc., etc. which is routine for anyone really who has a new symptom, but particularly with long COVID. And then probably the doctor will send you to have an endoscopy, an upper gastrointestinal tract endoscopy. Basically, that's a camera down the throat, into the stomach and through into the small intestine. It's a flexible fiber optic camera, which is very narrow bore, and the gastroenterologists are doing it all the time. So they've got the techniques to actually make it very straightforward and not distressing, not uncomfortable. And the beauty of this is that the endoscopist can visualize directly the lining of the throat and the esophagus and to the stomach and through into the small intestine, all the area that we're investigating or interested in with regard to swallowing problems. They're looking for inflammation. They're looking for evidence of sort of acid burning where it shouldn't burn. They're looking for an ulcer, for example. They're looking for any narrowing of the esophagus, or even any widening of the esophagus with a hiatus hernia, for example. But most important of all, they're looking for any nasty looking cells, nasty growths, cancer that could theoretically and probably would cause swallowing problems, because it sort of blocks the passage of food going through the esophagus. So endoscopy, it will be needed. And then, part and parcel of the whole normal case history and examination, etc., and the whole consultation is the GP all the time is thinking about red flags. Red flags, remember, red flags are those symptoms and signs that are suggestive of the sinister underlying diagnoses. And red flags in this situation with regard to someone presenting with swallowing problems would be swallowing difficulties that are actually progressing, they're actually worsening bit by bit. Patients may report that actually they're finding they're having to chop their food up into smaller pieces, and then they can't swallow those, and then they have to blend the food, or then they have to eat soups only. So that is suggestive of their swallowing difficulties are becoming progressively worse, and the food pipe, the esophagus, is actually becoming narrower and narrower and narrower. That's obviously highly alarming, because that suggests that there is a growth in the esophagus, slowly occluding the normal channel through the esophagus. That could be a cancer that needs to be diagnosed as soon as possible and dealt with. That's definitely a red flag. Likewise, weight loss. I said weight loss can occur because people become a bit more selective about what they eat and quantity-wise, etc. But obviously, weight loss is a cardinal symptom of a cancerous process, and so has to be taken seriously. Severe pain, likewise, again, can be is a red flag and can be an indicator of some sort of growth occurring at some point in the food channel. Repeated choking episodes, again, suggest there's something not right in that area, as I was describing, where the vocal cords come together and block off the breathing pipe, the trachea, when you're swallowing. If you're getting repeated choking episodes, it suggests that food is actually going down the wrong channel, and it is a worry, therefore needs to be looked into. Definitely a red flag. Basically, any red flag leads to one thing only, and that is an endoscopy, upper gastrointestinal tract endoscopy, to look for a cancer, to exclude a cancer. So let's put that to one side at the moment, and then let's go back to having assumed we've excluded the red flags. Endoscopy is normal. What are we left with? Basically, we're left with tackling those underlying causes for the swallowing problems. And in the long COVID context, that's to do with excessive inflammation. And as I said, that could be due to the excessive cytokines, but which we can't really do much about. But we can do something about the mast cell activation. So treatment with an H1 and H2 blocker will dampen down that mast cell activation and bring some relief. The endoscopy may have revealed inflammation, so esophagitis, inflammation of the gullet. And so if that's the case, then the doctor will prescribe a PPI, a proton pump inhibitor, to turn off the acid production. And if we've turned off the acid production, that enables that inflamed area, the esophagus or in the stomach, gives it a chance to quieten down, settle down, calm down, and for the inflammation to be taken away. So those are the things that we can do. Other than that, really, it's a case of symptom management only. How are we going to manage the symptom of swallowing problems? Well, I think first line is always the sort of the common sense strategies and advice. And that is, if you're having problems with swallowing, well, slow down, eat slowly, and maybe take smaller mouthfuls, and maybe chew your food more. So thorough chewing is suggested to make sure that it's not so bulky. Maybe sips of fluid, be it squash, water, between mouthfuls is helpful to assist the normal passage of that bolus of food. The other is I was referring earlier to the function of the vocal cords and the larynx to do with the opening and closing of the vocal cords, whether you're talking or swallowing. So sometimes, if you're talking whilst you're eating, then you're asking a bit much of the vocal cords to be shutting and opening. Sometimes food can go down the wrong way. So remembering certainly I can hear my grandmother saying now, don't eat don't speak when you're with your mouth full. Don't speak with your mouth full, Timothy, she used to say. And so, we want to have gaps, if you like, or not gaps, but, take a mouthful, swallow it, and once you've swallowed your mouthful, then you can talk to your grandmother if you want, and then stop talking and then take your mouthful. So don't speak with your mouthful, Timothy. Besides that sort of, if you like, common sense, self-help strategies, you could actually get extra help from a speech and language therapist. Like I said, speech therapists don't just do speech; they do also swallowing. So they can put you through a clinical swallow assessment, which they can sort of see where they feel that the swallowing problem is occurring, and whether it's something to do with the muscles of swallowing that in some way are not working so well, or could be helped by exercises that they can give you to actually build up, strengthen those swallowing muscles. They can teach you on techniques to improve the sort of the coordination of your swallowing and the timing of swallowing, to prevent that food going down the wrong way. They can teach you sort of postural strategies with head position with swallowing, i.e. not too hyperextended, not too flexed. They can talk you through the different positions in order to get the optimal position for you when you're eating. They can also give you sort of advice on dietary modifications and thickeners to make the sort of fluids a little thicker, because some people find food fine, no problems swallowing, no worries at all, but liquids tend to go down the wrong way. So speech and language therapists can advise on what you can do to mix into liquids in order to sort of make them a little thicker, therefore less tendency to go down the wrong way. Equally, they can give you advice on food softeners and modifying textures, so that sort of the mouthfeel of food is different in order to encourage more normal swallowing. Basically, the sooner that you can get this advice or advice from a speech and language therapist, if those simple measures have not worked, the better, really, because the outcomes would be better. Sooner the better, and that also helps towards reducing the worry, the anxiety that I was talking about earlier, that can result in your swallow problems and tightening up. I talked about this condition called globus pharyngeus, when patients say that I've got a lump in my throat, doctor, and it's just here. And it's more often than not, as long as other causes have been excluded with the endoscopy, etc., then it's probably because the neck muscles, there are 15 pairs of neck muscles all around the neck that are basically hold our head up and hold all the structures in place. They can become tense and tight. And when they're tense and tight, then you become more aware of your swallowing and food passing down your food pipe, your gullet. And that can make you sensitized to that sensation, that feeling, and that is what globus pharyngeus is. So reducing the tension in those, what we call the strap muscles of the throat, is very helpful as an additional way of reducing swallowing problems. So there we are. Those are the main points I want to cover in this posting on swallowing problems in long COVID. So let's pull it all together now, just a bit of a summary. So like I said at the start, swallowing problems in the grand scheme of things and long COVID overall, not that common. But if you've got them, you've got them, and you know about it, and they're a nuisance, and they just basically add to all your other long COVID symptoms. The fatigue and brain fog, etc., etc. Often those swallowing problems can be sort of, if you like, overshadowed by those other more troublesome long COVID symptoms. So therefore, they're not usually volunteered to the doctor or the long COVID clinic, etc. And patients just put up with them. But wouldn't it be lovely if we could relieve them? The usual presentations, like, food takes time to go down. They have to think about getting their food down, can get stuck. There may be some regurgitation or associated heartburn. And like I said, lump in the throat, globus pharyngeus. It's quite common. Whatever the cause, you've got a new problem, or it's a problem that is troubling you, you need to see the doctor to get the diagnosis, to get the guidance, some treatment if possible. Maybe referral on to a gastroenterologist for that endoscopy, and certainly to eliminate any red flags. Like I said, there may be some treatment available, and I covered those treatments that are available, namely mast cell activation treatments, the H1 and H2 blockers. Maybe it's the PPI, proton pump inhibitor, for excessive acid, to turn that acid production off, to let that those inflamed membranes lining of the gut calm down, settle down. I talked about dietary strategies and eating habits, and referral onto speech and language therapist, to help learn those exercises for those swallow muscles, and learn techniques and strategies to prevent food going down the wrong way. Basically, if you take all of that on board and the self-help things and the strategies and those treatments, then hopefully those swallowing problems will become less of a problem. And with time, along with the whole of long COVID, they will settle. Hopefully that will happen as soon as possible. But a lot of long COVID, as we know, is all to do with natural healing, giving it time, because still we don't have the treatment for tackling the fundamental underlying problems of long COVID, because there are so many of these causes. We know it's a multi-causal problem, bringing about these multi-symptoms, but basically lifestyle measures, thinking about diet and nutrition and sleep and reducing stress, etc., all strategies that aid that natural healing, that natural recovery. So there we are. That's my update on swallowing problems for long COVID. I hope you found it helpful. As I said at the start, this is an educational series for all of those of you who have long COVID still. Remember though, my usual disclaimer, anything I've said in this podcast, or, if you're watching this on YouTube, please discuss with your doctor. It needs to be taken seriously. Remember, safety first. So there it is. If this has been helpful, obviously click subscribe or share it with anyone else that you know who has long COVID. Spread the word, especially as a lot of the clinics and services for long COVID are being withdrawn or decommissioned. So a lot of long COVID patients are just feeling a bit sort of, if you like, pushed to one side. And I like to think that these podcasts, these postings are trusted resource for you to help you with your symptoms and as many of the elements of long COVID that you are suffering from. So in the meantime, I wish you well. I look forward to my next posting, and good luck with your long COVID recovery. So all the very best. Cheerio now. Bye-bye.